Hi, I'm Sanaya Gander. I'm a rising junior at Cal State East Bay, and I'll be starting the nursing program this fall.
I'm Jessica Flores. I'm a rising senior at UC Berkeley studying sociology, and one day I hope to be a medical provider.
As HCC interns, we were placed at the Lifelong Medical Care Ashby Health Center, which is located inside the Ed Roberts campus in Berkeley, California, and qualifies as a FQHC, Federally Qualified Health Center. It is one of the 14 lifelong primary care medical centers across Alameda and Contra Costa County. One of the unique aspects of the Ashby Clinic is how its behavioral health services are integrated with primary care. Our focus this summer was to assist the behavioral health team through the guidance of our preceptor, Dr. Bowie, a trained psychiatrist and the associate medical director for the psychiatry department across Lifelong Clinics.
The first half of our time at Ashby was spent working primarily with the behavioral health team as interim community health workers as the clinic was transitioning staff. This meant we had to get special EHR training. EHR stands for Electronic Health Records, and the system they use at Ashby is called NextGen. Once we were NextGen trained, we had access to schedule patients for their behavioral health appointments, assist with warm handoffs, conduct reminder calls for appointments, and set up internal referral appointments for primary care providers to behavioral health. Another project we completed was updating the behavioral health handout, which you can see here.
Apart from those duties, our main project this summer was to implement a resource database for basic needs and behavioral health resources across Alameda and Contra Costa. Our first step was to gather information about resources. This led us to adventures to many of the lifelong clinics, including West Berkeley, Howard Daniel, Brookside San Pablo, and the administrative offices. There we collected lots of resources. And after organizing them into appropriate categories, utilizing a flowchart, we were able to start working on a massive spreadsheet shared to us by a community health worker at the Howard Daniel Clinic.
After countless hours, we managed to completely update and insert over 800 resources onto the spreadsheet. Now, with all the resources organized in an electronic manner, we were ready to transition these resources onto SharePoint. SharePoint is a shared drive within Lifelong staff, very similar to Google Drive. By moving to SharePoint, our goal is to make the access and use of the resources much easier for all providers across all Lifelong clinics.
We also had the opportunity to shadow the wonderful staff at the Ashby Clinic, including the front desk, the medical assistant, community health worker, registered nurse, nurse practitioner, and our preceptor, Dr. Bowie, who is a psychiatrist. In addition, we've done vitals for patients and attended various meetings, including a behavioral health nursing residence didactics session, an all psychiatric provider meeting, and the monthly team meetings at the clinic.
To further broaden our internship experience, we attended a site tour of Sutter Health CPMC Pacific Campus in San Francisco, where we got all geared up to see the OR department in action. At near the end of our time at the clinic, we got the chance to showcase our internship experience to other HCC interns by hosting a site tour of our own.
Overall, these last 10 weeks at Ashby were fulfilling, challenging, but also very rewarding as we gained many new skills,
expanded our networks,
but more importantly, we have a better understanding of how we can contribute to the healthcare system,
especially the integral role of behavioral health.